I would ask that each of you keep your mic muted until such time as you're recognized, either for a presentation or to ask a question. And I thank you for your cooperation. I will be presiding tonight as the chair is tied up with her family. We have an agenda for this meeting, which I need a motion to approve. Can I get a motion to approve the agenda?
So approve.
Who is that?
So move.
I'm sorry, who made the motion?
It was Mr. Bland,
David.
Madam Vice Chair.
And it was seconded by?
Seconded by Ty Harrell.
Mr.
Thank you
Harrell.
very much. Are there any objections to us proceeding with the agenda? If not, we will proceed with the agenda as printed. We have minutes from our last meeting, minutes of the previous meeting, which have been distributed to you. Have you had an opportunity to review those minutes?
Madam Chair, I move we approve.
All right, I need a second.
Seconded.
All
Ty
right.
Harrell.
Mr.
Thank
Harrell, once again.
Are there any objections to the minutes? If not, they, as written, they stand approved. The chair did not give me anything in particular to bring to your attention tonight. I do, however, wish to make you aware that our budget and our proposals for next year, the 21-22 year, were presented to the City Council by Jeremy. And Jeremy, do you have any comments that you would like this to make to the board regarding that presentation to the City Council?
Yes, ma'am. The council is grateful for the work that we do, and they continue to support our work. So they're grateful for everyone's involvement in the board, basically, and they approve it, like you've said.
Do we know that they have approved our budget?
Yes, ma'am. They approved it. I believe they voted it. They voted for it at that same session and approved it, both the budget and the proposal.
Thank you very much.
You're
Okay.
welcome, ma'am.
Any questions to Jeremy regarding his presentation before the City Council? All right. Demetrius, do you have a report that you would like to give us?
Good evening, everyone. Good to see you all.
I apologize for skipping you, and I overlooked you. So go on, please.
You fine. Just one update. I received notification that Dr. Caesar's former position was posted, and applications is now being accepted for her former position. And that's the only. Yes, ma'am.
Do you know the deadline for applicants?
I believe it's next week sometime. I have to go back and double check.
Yeah, but anyone who's interested in seeing the position description can go onto the city's website and see it.
Yes, ma'am.
All right. All right. Anything else, Demetrius?
No, ma'am.
All right. Thank you very much. We have two representatives from RPD tonight who we have asked to present the ACORNS proposal to us, or I should say the ACORNS policy and its implementation. And those are Sergeants Renee Lockhart and Sergeant Jason Borneo. I don't know the order in which you guys would like to present, so I'm just going to open it up and ask you if you would start and identify which of you is presenting first.
I believe Sergeant Lockhart and I are going to co-present. And I will begin the presentation. Sergeant Lockhart, if you could show our PowerPoint and we can begin.
Thank you.
I am trying to get.
If it's okay with everyone, as she is preparing that, I just wanted to say that, of course, last month, the last time the board met, that's when I did my introduction and spoke just a little bit high level about the ACORNS unit. But we have invited Sergeant Borneo, who was at the beginning stages, the implementation of this initiative when Chief Deck Brown was in the seat. And then, of course, Sergeant Lockhart is now over the unit as a sergeant. And so she's doing the day-to-day work. So I believe that they both could really give you a good background and insights into what this unit is doing as we move forward with it.
Thank you, Chief. And if Vice Chair Sims, if it's okay with you, we can go ahead and begin.
Please do. Thank you.
And thank you very much for the introduction, Chief, and thank you very much to the board for your invitation this evening. I had the pleasure of speaking with all of you last year to discuss the role of research in policy, process, and initiative development. And we discussed the importance of being an evidence-based, research-driven, and community-focused organization. And at the time, the ACORNS unit was in really its early development. And I think Chief Patterson last month had mentioned that this unit is really in its infancy, which means that at the time that we last met, the idea was just simply that, merely a vision. My colleague, Sergeant Renee Lockhart, who oversees the unit, will discuss how she and her team is making that vision a reality, based on research and evidence and focusing on our community. But before I turn it over to her, because you heard kind of enough from me last year, I want to provide just a very quick overview of how we went about planning, developing, and implementing this initiative. Sergeant Lockhart, next slide, please. The ACORNS initiative was really born out of a simple vision, and it was born out of an identified need and to deliver community and social services to our most vulnerable residents in a very different way. And one might argue that the police have no role in delivering social services to our communities. Sergeant Lockhart, next slide. And
I'm having issues trying to advance the slide, so just give me 1 second.
And we can kind of continue on to just kind of keep things going. And the reality is, and I believe Ms. Soroka had mentioned at last month's meeting that the question about whether this belongs in the police department, and the reality is, it's somewhat of a cliche that it takes a village, and that the police profession is really an integral part of that village. Being so public-facing affords us the opportunity to harness and capitalize on those relationships that are naturally built through community policing and intelligence-driven efforts. How are we looking, Sergeant Lockhart?
Our computer's frozen, but we can continue on.
Okay. So the next slide that we were intending to show you was some phases of the development of this program. So our approach to the foundation of this unit is really multifaceted, and only through background research, national and local benchmarking, and collaborative coalition building can this program be successful and tailored to the Raleigh, North Carolina community. So background research included the understanding of the anecdotal evidence. And by anecdotal evidence, the most prevalent evidence really came when COVID-19 forced everyone inside, and those that had no place to go were left out in the cold. And we know from anecdotal evidence that there can be a nexus between people experiencing homelessness and mental health and substance use disorders. As an evidence-based, research-driven organization, we analyzed our calls for service of several years to understand and illustrate the issues that we're facing. We scoured dozens of publications from academic, research, and government institutions to understand the complexities of our problems. And then to understand what problem solving looks like in practice, we benchmarked with other agencies from across the country, looking at their policies and procedures, resources used, budgets, training, and structure. There's a slide here about the development plan that we approached. And what you'll see is that we spent 5 months from November 2019 through April of 2020, I believe, researching the best practices and presenting our findings to the chief and to other members of the leadership team here at RPD. And what has been somewhat different in our approach than many of our counterparts in other areas of the country is how we really engaged our stakeholders early on in the development of this unit. And as I said before, we are evidence-based, research-grounded, and intelligence-led, but I think most fundamentally important is that we are a community-based department. We engaged our community partners from around the county and asked them, what are the gaps in services? How can RPD help fill those gaps? And we've used the Way Continuum of Care to really help guide this program. And we are so thankful for the many agencies that have provided input. April 2020 through February of 2021, our focus became on resource and policy development. We examined best practices in uniforms, vehicles, technology, training, policies. We spoke with a multitude of agencies and even spent the day with the Community Policing Crisis Response Team in Charlotte-Mecklenburg, their CPCRT, ultimately leading to the conclusion that a co-response team of officers and social workers would be a suitable model for us. We designed uniforms, planned for the upfit of vehicles, developed training, selected technology needs to be used by the team. And let me conclude by saying that this program was not created merely through the law enforcement lens. At the time, my graduate level intern happened to have a background and a master's degree in social work. She was instrumental in and at times led the development of parts of this program. Since we knew this was going to be a co-responding team, we had to ensure that when we looked at this program, we needed to look at it through a holistic lens. And because she spoke the language of social work, the ACORNS policy and processes are reflective of the care and safety first, enforcement last approach and philosophy that really encompasses the mission of the ACORNS unit. I believe Sergeant Lockhart will talk a little bit more about that. Sergeant Lockhart.
Thank you, Sergeant Borneo. I also sent you the PowerPoint just in case you can get it up and on your screen. So thank you all for having me this evening. I'm very excited to talk to you all about the ACORNS program and where we are so far. So let me just let you know what our mission is. So the mission of the ACORNS unit is to make sure that we connect with individuals in crisis and provide them with resources that are needed for them to meet their individual goals. So when we talk about crisis though, I want to back up and make sure I'm clear on this. When we're talking about crisis, we're talking about the crisis that person is experiencing in their life. And the three focus areas that we're looking at is homelessness, mental health, and then also substance use, okay? And so we're not necessarily referring to someone who is in an emergency crisis. We're speaking of individuals who their life right now is a crisis to them, and we want to help them through that. And so the other thing about ACORNS is a voluntary process. People have to want to participate with us in the process. Oh, great. Sergeant Borneo has the slides working now. Awesome. So now you can see exactly what I'm referencing when I say what our mission is. Next slide, please. All right, so who makes up the team? The team is comprised of a sergeant, that's me. We do have a detective, 3 officers, and 3 social worker positions. I'll let you know right now we have 2 social workers hired, and we've already had the interviews for the 3rd social worker, and maybe by the first week in November, we can have the 3rd social worker hired. Next slide, please. So how do we conduct our mission? We have a 5-pronged approach in conducting the mission of the ACORNS unit, okay? And that includes outreach, education, case management, field services, and then investigation and intervention is the prong that we kind of combine together, okay? So it's a 5-prong approach. We do receive a lot of referrals, and we do go out in the field. And when we go out in the field, our approach is actually a social worker and officer approach. I'll go ahead and tell you, we're like a team. So sometimes the combinations are a little different, but we do make sure that we have an officer and a social worker responding out in the field. Our approach is a care and safety first approach, which means enforcement is last. Next slide, please. So the makeup of the unit, actually, when we went live, when we started on June 12th, and you already received this information. I'm just kind of making sure everyone's aware again, just to recap. We started with a sergeant, a detective, and 3 officers, and that was on June 12th. So as you can see, when we first initiated the unit, we didn't have the social workers actually working with us, but that doesn't mean we weren't busy and we weren't actually responding out into the field, providing assistance to those who, again, were experiencing homelessness, mental health issues, or substance use. On July 6th is when we actually moved into our ACORNS building. So ACORNS is separate and apart from any police facility. Okay, so we're our own entity in our own building and providing services from our site. On August 23rd is actually when the 2 social workers joined the team. And so the social workers, them coming on and assisting us, we've been able to tap more into that prong of case management, because that's what social workers do. And I'll tell you, I keep saying social workers because that's exactly what their title is and the function that they operate in. They are not clinicians, which means they are not diagnosing anyone. We are not doing assessments. What we're doing is actually connecting people to resources that are out there in the community. And what we actually found, even working the officers and detective team working together, is that a lot of our contacts, and I'm going to call them contacts because they're not clients or patients or anything, they're people we come in contact with. A lot of our contacts actually are already connected to services. However, there has been some gap or some time between the contact actually being able to connect with the case manager. And one of the important parts of the ACORNS unit is that because officers see person in environment, this is a social work term, I'm an MSW, by the way, we see people in environment, so we know what's going on with them out there. We're able to connect that to case managers who might not know what's going on with one of their clients or the person that they're working with. We fill in those gaps and can help folks through that. Next slide, please. So, in what we do, we have a lot of community partners that we work with to help us. Again, we're simply providing the referrals or making the connections. We are not doing a lot of the service that our community partners are already providing. So we've become a part of the Wake Continuum of Care. We are a part of the Wake Raleigh Partnership, which their focus is to end homelessness in Raleigh. And so we have partnered with them as well. The Familiar Faces Initiative is another one that that ACORNS has joined. And basically what this initiative is looking to do is some of the individuals that different systems, whether that be the court system, the hospital system, the police departments, see a lot of their familiar faces. We want to see how we can better assist them and provide services that are needed. So we collaborate with Familiar Faces as well. And then of course we have the Downtown Raleigh Alliance, in which they actually already have a social worker assigned to their area, the Moore Square area, Moore Square Park, and that type of thing. And ACORNS partners and works with her. On that note, just to make sure everybody's aware, ACORNS is a citywide effort. So we are not just located in one part of downtown. And you saw who's assigned to the unit. So the thing, we're covering a lot of ground here and we stay extremely busy. But in the midst of that, we might have to make sure that we stay educated. We educate others, but then we also educate ourselves. So everyone's fairly new to the unit, right? And so we've been actually conducting ACORNS training days. And so we want to train together as officers and social workers because everyone has individual roles and we want to make sure everybody understands what their role is. And also we want to learn about the community that we're serving. And so the ACORNS days have now essentially become half days because again, we're very, very busy with a lot of contacts that we have out there. Another thing that we're doing is conducting roll call trainings with our field operations divisions. We actually already did that. So with patrol officers, making them aware that ACORNS exist and letting them know how we could be useful to them. We're also conducting some elective trainings for personnel. So for instance, we would have one coming up with community officers, in which we have invited some of our community partners, Oak City Cares and Healing Transitions, to come in and explain to community officers exactly what they do and how community officers can also seek assistance from them as well. And then we partnered in the HMIS system, which is the homelessness system, in which we can go in and actually, remember I told you earlier, we know more about what's the person and environment, what's going on outside. We found that the system actually might have outdated information or things like that. And we're able to go in and update that information. So those case managers who are at the desk actually have the latest information on where some of the individuals are that they need to reach. And then again, as I mentioned, education is important. And we do a lot of what I'm doing now is actually talk to you all about what ACORNS does and what we can do and that type of thing. And then also we want to make sure that we're a resource. So we're providing resources to other partners that reach out to us. Next slide. So I did provide you with a little bit of data, just so you know. So if you think back again, we didn't start ACORNS until June 12th, and then we weren't fully up and running with a full team of social workers until August 23rd. So keep that in mind as we cover this data. So right now we have 139 contacts in Raleigh. So what does that mean? That means either someone reached out to us and said, hey, could you make contact with this individual? I'm concerned. Or our officers, this is the officer role, what they may have done is actually gone through and looked at some data, calls for service, and recognize some incidences in which ACORNS could be beneficial afterwards. And so they've self-initiated those contacts and added them to the list of folks that we want to reach out to. And so I did mention that ACORNS is not being dispatched to calls, but they are actually out in the field. So our office is only where we gather as a team to talk about what we're going to do today or what happened yesterday, but all the work happens actually in the field. So the 139 calls for service that you see were actually generated by our ACORNS team. So those are the personnel out there initiating calls for service, making contact with folks. And the last time this was updated was back on October 12th. So that's the latest for that portion. So we have 14 informed consent and privacy practices form that we fill out. So anyone that we're working with on a more thorough basis in which we might want to get more additional information from them, we want to make sure that we have their consent to be able to talk to other folks about them and about what's going on with them. And so we have 14 of those forms filled out. That's where we're setting goals, goal planning, and making sure that the individuals reach their goals. And we're looking at long-term stability. And that's what those consent and privacy practices forms are for. Now, just recently is when we've actually created the formal referral form, okay? And so that just started on October 6th. We just got up and running internally where officers and personnel can send us a formal referral, and that referral goes to our ACORNS email. And we have 7 of those right now, because all of the other ones are actually informal. And we're still getting those type of contacts where we get cold calls or we get an email. It just hasn't started filtering to our formal form yet, but it soon will. This form is also a form that will eventually be provided on the ACORNS website so that anyone in the community that would like for ACORNS to reach out to someone, you can fill out that form and that information will get to us for us to follow up. It's not available yet. I hope that any day now it would go up. I know that I've asked for it to be provided, so hopefully soon it is there. So again, people in the community can send us a referral. Now you have to have some detailed information on the individuals for us to be able to reach out, but that is an option as well. Next slide. So I think the last slide is just to ask you all if you have any questions, and I'm providing the ACORNS email, which is up already. We do have an ACORNS main line. So If someone's in the office and someone calls the main line, you can reach any one of the personnel that work on the ACORNS team. But then I've also provided my contact information, my desk line, and then also my email address. But I'll open it up for questions now from the group.
Madam Chair, this is David.
Yes, David. You have a question, David? I'm sorry, David, you must be muted. Can't hear you.
Yes, I have several questions I'd like to raise.
All right, let's have your first one.
Why did the RPD decide to be a deliverer of services versus a connector of services, for example, as they do in Durham?
And to whom do you wish that question directed, David?
I'm not sure who, Sergeant Lockhart, I guess, is the one that's responsible.
Yeah, sure. I can answer that question. We actually are connecting folks to services. So we are doing that. Are you asking why did Raleigh decide to have the officer and social worker together? Because we're not necessarily providing the services that our community partners are. We're making sure that folks get directed there. That's what we're doing. So we're still connecting them. We aren't doing the actual services ourselves.
Well, if you're not doing the services yourselves, why do you require the informed consent statement?
Oh, great question. Because we might actually want to talk to those providers about some of the things that we are actually discussing with the individuals. So for instance, some things that have occurred, I can give you some real examples, is we've actually been able to connect folks to, we've taken folks to get their ID. We've taken folks to go pick up medications, those type of things. And so if we start to, especially the social workers, if they start talking about their plan, their goals for themselves, we want to make sure that we can then refer that to the case manager who might actually be working with that person in more detail. So.
Now, David, I realize you have a series of questions, but I don't want you to take up all the time. So let me switch from you to someone else and we'll come back to you a little later on for the rest of your questions, okay?
Very well.
All right. Who has the next question, Cindy?
Not quite yet. I'll have one in a moment. Give me just a minute.
Is there anyone else who's waiting with a question right now?
Madam Chair, this is Ty. Oh, I believe Greer had his hand up.
All right, I'm sorry, Greer, I didn't see that. Greer?
That's okay. Thank you so much. And thank you all, three of you, for being here. I know I wasn't able to make the last meeting, so it's good to meet you, albeit virtually, Chief, this meeting. I guess this question is directed towards Sergeant Lockhart or Sergeant Borneo, who was mentioning the research that went into this. I guess it's a two-parter. First of all, are y'all aware of the Oregon program, which is called CAHOOTS, and then the Denver program, I believe, which is called the STAR program? Okay, I'm getting some nodding of heads. So I guess my
noted that, Greer, when you were not here.
Okay, sorry about that. Well, perfect. I guess my question is, in both of those programs, I don't believe, and I've got them pulled up as well, that they dispatch police officers alongside those community partners. Specifically not, I know you can call 911 in Denver and then they make that exchange, but in Oregon, I don't believe any police were sent. And that is due to their findings that sometimes, actually oftentimes in marginalized, racially specifically, marginalized populations, the presence of police officers is actually frightening or concerning. And I know you mentioned continuum of care, and that type of conversation and discussion was had in trials such as the George Floyd trial, for example. So I'm just wondering why Raleigh chose to do it that way instead of just funding a program out of the city budget that did not send police officers and maybe was housed somewhere else. Didn't know if either of you had takes on that.
And thank you, Mr. Webb. So we did look into both of those programs, and I had some conversations with the Eugene, Oregon Police Department regarding the relationship and how their processes work in delivering services, and how the COOTS program, like you said, delivers programs independently, delivers services independently of the police department. I think from the development standpoint, questioned about what can we do right now with the resources that we have right now. I think from Chief Deck Brown's perspective, having the positions that we have within the department was a lot easier to begin to develop this program versus trying to find partners that we have that we would connect with. For example, in Eugene, Oregon, the COOTS program partners with the Whitebird Clinic. So finding those resources will probably taken a little bit of time versus being able to develop this program in-house.
All right, Greer, do you have a follow-up question?
I do. Yes, a follow-up comment. I do appreciate that. I think when we also compiled, and forgive me for not being here last month, our data, I just wanted to again raise that, I guess, objection more so. And I guess it's not just publicly a condemnation of this program since it's already been housed and is up and running under the police department. But just speaking more generally, I guess, to the city, I would have wished that this program didn't have as much of an enforcement mechanism. I know that Sergeant Lockhart mentioned that that was the last avenue, but I just think that program, and I do believe that in just conversations that I've had, that maybe there aren't enough, but there are at least some clinics that, when given the option, would provide those services instead of, in this case, dispatching. That ratio, I guess, in the case of ACORNS is just a bit troubling, just the number of armed and badged officers that we're sending to these folks that are experiencing these crises. But I guess that's not really a question. So I thank you for that, Sergeant.
All right. Well, then, Greer, let me ask you if you'll lower your hand. Thank you. Okay.
You're welcome.
Is there another question from anyone?
Mr. Bland wishes to be recognized, Madam Vice Chair, but Mr. Harrell was in the queue before Mr. Bland.
That's fine. Yeah.
Let's go to Mr. Harrell first.
Thank you, Madam Vice Chair. I lowered my hand perhaps prematurely. My question is more or less a jump ball for either of the sergeants. But it's probably leaning more towards Lockhart since it was in her presentation. The final screen listed contact information. And the comment that accompanied it was, if we're in the office to answer the calls. I'm curious to know if you're not in the office, because it's my recollection that everyone is out in the field. Who addresses those calls once they come in? Where do they go? Is it an AI system? Is it an artificial intelligence system that, press 1 for this, press 2 for that? Or is it rerouted to another facility to address the concerns to get to you? And I'll listen to your response on mute.
Thank you for the question. So the calls that we receive are coming to a voicemail line. And on that voicemail, we're making sure that folks understand it's not a crisis line. So again, I tried to explain to everyone that we are not responding immediately to someone who is in an emergency crisis. What ACORNS is trying to do is actually follow up after the person, if it's a mental health crisis, after the person has come down, when we can now talk to them and work through whatever it is, or their family members, that's when we're following up. So the main line, if no one's in the office, there's a voicemail that we check, and then we return calls from there. So it's not an emergency dispatch type of situation.
And Ty, do you have a follow-up to that?
I do, and I've got several, but what I'll do is I'll just limit it to the clear and present, and that is, if it's going into a voicemail system, there's so many follow-ups. If it's going into a voicemail system, what is the response time and if it's not categorized as an emergency, a crisis of emergency, but it's a crisis of immediacy, how does one get to those calls, and how quickly can a response be given? I guess would be my follow-up, and I'll listen on mute.
So we follow up as we can. Right now, I can tell you there aren't a lot of calls holding in the queue. for that, because again, it's not an emergency dispatch line. So these are folks calling and saying, hey, I would like for you to talk to such and such. I think people understand that it is a follow-up type of procedure that we're doing. And so as we follow up. Right now, I'll tell you the shifts that we're working. We work Monday through Friday, and we have a 8 a.m. to 4:24. I do make sure I mention the 4:24 because we work an 8.4 hour day. And then we also have an evening shift to 7:24. And so the latest person that is here is from 7:24 in the evening. We will eventually work some weekends and things like that when we do outreach and other things of that nature. So we haven't really been able to do the outreach like we want yet, because again, we're a fairly new unit and we want to make sure that we're all getting to know each other and training and that type of thing before we go out. We've had one formalized outreach event, which was in Moore Square Park, and we did that, but there are more to come. Again, very new unit, so we're just starting out.
Let me add one other thing too. I think Sergeant Lockhart, you forgot to mention is that even though you have the set hours for the team, you're also available if we need to call you for anything. We had one incident with a barricaded subject where we had to call and got some assistance there. So they are also available if we need them after hours.
Yes, another example would be, we had an officer that called us and it was a weekday night late. And there was a young mom with a child and she had nowhere to go. And the officer knew that it was about to rain in the next 30-45 minutes there. And all of the service providers were closed as well, but he reached out to ACORNS and we were able to find some connections to get them safe for the time being until in the morning, when all of the program providers opened up to where we could get her better situated. So just another example.
All right, thank you. Are there any other, I don't see any other raised hands, so.
Madam Vice Chair.
There
Dr.
are a few. There are a few.
Recognized, and then Greer, and then Mr. Bland.
I'm sorry, who's next? Jeremy?
Dr. Cottle, ma'am.
All right, Dr. Cottle.
Yes, thank you, guys, for showing up and presenting that. I wanted to ask first if you could tell me a little bit about the consent process. And that could be for, I guess, Sergeant Lockhart, if you could tell me how the consent, it's an extensive consent process. I read through the appendix and I was just wondering if you could tell me how that's gathered, how that's obtained.
Great, yes. So, okay, so you saw it, I printed it off. It is a detailed form that has to be completed if someone wants further assistance from us. So what we do is we actually sit down and go through the form, just like anyone else would. And I'm speaking from a social worker mindset primarily. So we go through the form with the individuals, and we've had some folks that say, oh, no, it looks like I need a lawyer for that and I don't want to fill that out, and that's fine. And so we will continue to help them to the extent that we can without doing the things that we're requesting here, okay? So.
If I could follow up on that. So when you're going through those, it's pretty broad in terms of, so they are consenting to provide information that could be used for a range of purposes, as I understand it. So for intervention, for research, for investigations, and for just a range of things. Are there risks or limits, or are the risks explained to, I guess you didn't call them clients. I'm trying to remember what you, cases, I guess, or something. I can't remember what you said, but.
Contact, yes, they are
contacts, sorry.
Contacts, yes.
Are the risks explained to them in the same way, like, for example, a Miranda right might be explained to them?
So this particular form, we're going through it in detail with them, but this form is actually allowing us to provide additional, to actually talk the service provider individual. So it is not about an interrogation or investigation in that manner. Now, if we do have someone that is in custody and we want to work with them, we do have a separate form for that, in which there is an additional witness, their attorney, for instance, who we want to make sure is clear that we're working with this individual. But simply because we're working with them does not necessarily mean that any charges, we don't have any control over the charges of against the individual, but we want to help them get better. We want to help them be well. And so there's a separate form for that, but we haven't actually encountered that yet. Again, new unit, but we're trying to prepare for circumstances that might come up as such.
So is the information that they provide to you then, I guess, would that be protected then? And not be able to be used against them in some manner?
Right, and so we're not going to use any information that is given to us against an individual. So now when we start to talk about social worker officer roles, right? And so as the social worker, who's primarily the one that is filling out this form, okay, the social worker role may actually find out a little bit more about the person than an officer really needs to know. And this is why our roles are separate. And so also in our note taking and our note keeping, we don't want to make sure that social workers have separate note taking as well.
So in the database that you mentioned that you guys can update information in the online database, that the information they're giving you would not go into that database because it's a distinction between the social work and officer.
Right. So first of all, that database is simply for ACORNS. The one I'm talking about is simply like demographics, just generic information. This is who we're working with, so everybody knows, right? And so it's not necessarily the inner workings of what's going on or anything like that. It's just who our contacts are. And that is only accessible by ACORNS personnel. So any other specific, if a social worker is working an actual case, that social worker is going to keep information and record it separate and apart from our police system and things like that.
So they have no access to
ACORNS
that
officers
information. Chief Patterson couldn't get any access to any information, even the names or identities of the individuals who are receiving any sort of service or interaction or providing information to ACORNS at all.
Right, exactly. Now, if there are things that we might want officers to know for just safety reasons, okay? If officers may have come across this individual, they're the ones that reached out to us about this individual, then we would provide limited information into our officer system, because these initiations do come from police officers. The officers are the ones that are concerned about our contacts. And that might be another thing that I didn't highlight enough, is that officers are reaching out to us because they're concerned about these individuals. And it's not to say that we're going and providing the details of how assisted folks, but at the same time, there may be some things that would be beneficial to officers that we might provide, but it's not the case notes and it's not the detailed information as to how we're working with the individual.
Sergeant Lockhart, would it help to maybe give an example of that? So for instance, if we know somebody suffers from PTSD, based on your conversations with them, and that certain things are a trigger point for them, that is what would be shared with the officer. So if they were to encounter this individual, then they know how to respond and how to interact with that individual.
Yes, so we've created an ACORNS only report, which means ACORNS officers fill it out for police personnel to look at, so that they know if you come across this person, a great family member for this person is listed here, or this is this person's triggers, or this is a way that some things that might calm them down, so that they would know and be able to provide better service for them.
So for those cases where the limited information is given to the officers, just so that, and I understand, I worked at crisis assessment, and I know the distinction, and a lot of those officers really care a lot about the clients. well, we call them clients that are there, but if limited information in those cases, is there any sort of guidance that ACORN staff are provided, or officers are provided, that directs how much of that information is given and when Miranda rights might need to be provided to a person to protect that side of that client or case?
Are you speaking to ACORNS officers needing to provide Miranda rights? Because again, we're
Any
not.
officer, any agent of the.
Well, that would be separate and apart from what ACORNS is actually doing. So
Well, I
anything
meant you said
enforcement
limited
is-
information is provided to the officers a little bit ago. You said that sometimes the officers need to know certain limited information. And I'm just wondering, in those instances, when the individuals are providing consent, at some point, it seems like a slippery slope in some ways. And you know, when I've done evaluations, for example, for the state, I know that there's sometimes this point where I feel the need to remind clients that they have the right not to say something to me. So I would just wonder if there's any guidance about, okay, well, maybe this is going in that direction or not.
I don't know how to answer that because we haven't gotten there yet. And I want to make sure that I say again, we're not doing assessments, and we're not diagnosing folks and getting into the weeds of those type of things. All we're simply doing is connecting folks to services and working with them in a manner in which we can actually be able to do that.
Okay. And one other question, if I may, Madam.
Cindy, I'm gonna
Totally different.
Totally different question. Stop you there, and let's recognize the next person on the list and come back later.
Absolutely. Thank you.
Okay, Jeremy, who was next on the list?
Mr. Webb, Madam Vice Chair.
All right,
And
Greer.
Mr. Blind was in the queue, but is he okay? Like he's no longer with us, so just want to make sure he's okay.
Greer, you have a question, a follow-up question?
I do. I'll try and be brief. I know we're at 7:50, so if I need to make oh, what's that?
I said, please be brief.
Okay, great. And I know there may be a community question in the chat as well. So if I need to motion in a bit to extend the meeting for just a few more minutes like we've done before, I will. But my question is, and again, if I missed this in response to Mr. Harrell, then please forgive me, or last week. The first part of it is, so someone calls 911 and they're in distress, and they say they want ACORNS versus just the police to respond to this because it has something to do with mental health and not necessarily a crime. What happens then?
Great question. So actually, if someone is in distress and they call 911 and they're asking for, they wouldn't necessarily ask for ACORNS, they'd be asking for a CIT officer, a crisis intervention team officer. And so that specially trained officer will respond out and handle it. If they need assistance from ACORNS, that CIT officer would then reach out to ACORNS. Again, we are not responding to the emergency. We're more responding once the person has come down and providing wraparound services. Interestingly enough, we are part of actually RTI International is doing some research and looking into our ACORNS pilot. And because of that, they've actually partnered with some other agencies in North Carolina, and ACORNS operates differently than those other units. And what they said is that's the piece that we're missing. We're missing what you all are actually doing because you're able to actually provide more wraparound services or make sure people get connected to those services. And that's what's missing. So we already have CIT officers out in the field that handle the emergency call, and we're the ones that come in afterwards and provide additional assistance. Also, I know you talked about earlier the uniform. One of the things with ACORNS is because we're not automatically responding out to emergency calls for service, we wear plain clothes. So we wear plain clothes. Yes, we still have a badge and a gun, but our guns are covered. And that does make us more approachable when we're following up. Because again, remember you guys, we are following up after something has occurred and things have come down a little bit. So just to provide.
Thank you. No, that's very helpful and clarifying. That leads right into my second question. But since you brought up the CIT, I don't know if this is a question for you or the chief. It's another two-parter. First of all, how many officers are CIT trained in the Raleigh Police Department? And B, why are all officers not trained in CIT?
Very good question. So currently we have 439 officers who are CIT certified. RPD is different than most police agencies, even my former agency that I came from. We provide CIT for our officers when they are in the academy, and which is great because they get that introduction, they get the training, and then when they go out in the field, they're already prepared, if you will. Some police agencies, my former agency, you got CIT training maybe a year, 2 years after you got on the police department. I think the model that RPD has is a better one where we're getting them trained up front so they know the warning signs. They're able then to see that and be able to de-escalate a situation when they are dealing with somebody that might be in crisis.
Okay, so just to clarify, sorry, 439 are CIT certified out of how many?
Out of our allocated 800 officers.
All right, let me move back now to, is David still on the line?
No, ma'am, he's not.
He's not. All right, so Greer, if you would lower your hand. Is there another?
I'm not sure, just Vice Chair, I'm not sure if you're able to see, but we've been raising and lowering our hands. So mine is down. I think Deontay's was up. There's a comment in the chat. So I'm not sure if you're aware.
No, but I didn't see.
I was going to address those though, Madam Vice Chair. Thanks, Greer.
I'm sorry, go on. Jeremy, who's next?
I have a question for the chief, if I may, but do we have time, Ms. Genevieve, or no?
Well, who was next to you before your question?
Deontay, ma'am.
All right, let's do Deontay and then come to you.
Deontay, you're muted.
Go ahead, Mr. Roca. Go ahead.
Are you sure? I was just wondering, Madam Vice Chair, if I may continue, please, for the chief. Well, first of all, thank you all for being here. I am grateful that you took the time out of your day to sit with us and explain ACORNS. I guess my question, Chief, is since it's Chief Dak Brown started this, where do you see it unfolding? What vision do you have with this program? You've noted many times, and it is in its infancy moment. So we can, as a city, be an example, I feel like, for the nation. And so I wonder if you've thought about that, ma'am.
Right. So I haven't seen two models now. The model that I saw in Charlotte, which was effective with the CRT team going out on calls, and they respond to emergency calls, someone in crisis, and then coming here to Raleigh and seeing our model here. I like the direction that we are going here in Raleigh, providing those follow-up services, because I think that's the most needful part, is ensuring that you have someone or you have a unit that is following up with individuals, continue to do that follow-up so that we don't have another encounter with them. If we can minimize that at all costs, that is a win for everyone. And I think this is what we are seeing already with ACORNS. And I've seen it in real time for the 3 months that I have been here, where we have called on our ACORNS unit to do a follow-up with individuals. And we are seeing that we have not had another encounter, because they're ensuring that if the person needs medication, that they have their medication. They're talking with family members to make sure they have continued care. And I think that's important. Now, time will tell, of course, because we are new at this, and we'll see, within a year how it really works out compared to other models. But I got to say, I like what I am seeing so far, and I think we should continue on this trajectory that we're on right now.
All right, I want to thank Chief Patterson and Sergeant Lockhart and Sergeant Borneo for coming. We have a number of questions which we could not reach because of the time. So are you amenable, Chief, to having us submit some more written questions to you concerning ACORNS?
Absolutely, yes. If you want to get that to Evan Raleigh from the city, and we certainly will respond to those.
All right, and I appreciate that very much. And again, thank you guys for coming.
And Madam Vice Chair, should we submit the questions as well that are in the queue with the chat to those questions?
Yes, I would say
I'm
that
going to take note of the questions.
in any of the questions that are in the queue, that are in the chat, would be submitted along with the questions that come from other board members. Okay, so if you make sure that we have those. We have some committee reports. I'd like to move to those now. And is there a report from Policy and Procedure? If not, is there a report from a community engagement?
No, ma'am, not that I'm aware of.
All right.
No
Is there-
report from community engagement.
I'm sorry, say that again, Ty.
I was saying there is no report from community engagement at this time.
Okay. Thank you. Is there any other business that needs to be discussed this evening? I know that the chair came on. I don't know if she's still on.
She is.
Madam Chair, do you have anything that you wished for us to discuss?
None. None.
All right, thank you very much. If not, I don't believe there are any other action items for us to vote upon, and we're running up against the 8 o'clock hour. I want to thank again all of you for coming, and can I get a motion to adjourn?
I move that we adjourn the meeting, Madam Vice Chair.
A second?
Seconded.
Thank you. Meeting is adjourned. We'll see you next month.